afternoon all. Today we will discuss about end of life care. What is end of life care? End of life care is the term used to describe the support and medical care given during the time surrounding death. This type of care does not happen only in the moments before breathing ceases and the heart stops beating. Older people often live with one or more chronic illness and need significant care for days, weeks, and even months before death. What is death? Death can be defined as a cessation of all vital functions of the body, including the heartbeat, brain activity, and breathing. Next, we will see about the goals of end of life care. This is to provide comfort and supportive care during the dying process, to improve the quality of their remaining life, to help ensure dignified death, and provide emotional support. What all are the physical manifestation of approaching death? So when we see in the system wise, sensory, there will be decreased sensation, decreased perception, blurring of vision, sinking and glazing of eyes, blink reflex absent, eyelid remain half opened. So in integumentary system, there will be mottling on hands, feet, arms and legs, cold and clammy skin, cyanosis on nose, nail beds, knees, and wax-like skin. So in the respiratory, increased respiratory rate, chain stocks respiration, inability to cough or clear secretions resulting in grunting and gurgling. So in the urinary system, decreased urinary output, urinary incontinence, unable to urinate. Gastrointestinal system, accumulation of gas, distension and nausea, loss of sphincter control. Musculoskeletal, inability to move, sagging of jaw, difficulty in speaking, difficulty in swallowing, loss of gag reflex, jerking. Cardiovascular, increased heart rate, slower and weakening pulse, irregular rhythm, decreased blood pressure. So, what is the psychosocial manifestations of approaching death? Altered decision making, anxiety, withdrawal, decreased socialization, fear of loneliness, fear of meaninglessness, fear of pain, hopelessness, unusual communication. Next, we will see palliative care. Palliative care is any form of care or treatment that focuses on reducing the severity of diseases, symptoms, rather than trying to delay or reverse the progression of the disease itself or provide a cure. Focus on improving quality of life for patients and families, provided during any stage of life-limiting illness, acute, chronic, or terminal. Palliative care programs include relief of physical suffering, care of emotional needs, bereavement support, curative and life-prolonging treatments. So it contains an interdisciplinary team including physicians, nurses, social workers, pharmacists, and physical and occupational therapists. So palliative care promotes quality of life, treats the whole person, supports a family. It is an extra layer of support for all. Next, we will see hospice care. Hospice is not a place, but a concept of care that provides compassion, concern, and support for the dying. So what are the benefits? It offers a familiar environment, provides a comprehensive plan, competent professionals, offers personalized care and support, give a sense of dignity, lessens financial burdens, provide family counseling. Just we can see difference between palliative care program and hospice care. So palliative care programs, as we discussed, it contains focus on comfort care, curative or life prolonging, no time restrictions, do not have to be terminal. Care teams oversees care administered in hospitals, extended care facilities, and nursing homes, and bereavement support. So hospice care focus on comfort care, does not include curative or life-prolonging measures. Life-limiting illness with prognosis of 6 months or less. Rely on family and visiting nurses, and care is usually provided in the home. Bereavement support. Next, we will see about nursing management of a patient at end of life. So, it should be holistic care. It should contain physical support, social support, spiritual support, and psychological support. So, physical support, there will be management of pain, control of distressing symptoms, serving nutritious food after daily analysis of the individual's requirement. So, social support, acceptance as part of a group, encouraging sense of belonging, treated with dignity as a fellow human being. So, spiritual opportunity to give and forgive, encouragement to end quarrels and reconcile, getting ready to depart in a calm and peaceful frame of mind. Psychological, professional counseling to provide a feeling of safety and security, helping rediscover a sense of worth and self esteem. People who are dying need care in four areas: physical comfort, mental comfort, emotional needs, and spiritual needs. So, providing physical comfort. Discomfort during the dying process can come from a variety of sources. Depending on the cause of the discomfort, there are things you or a healthcare provider can do to help make the dying person more comfortable. For example, the person may be uncomfortable because of pain, breathing problem, skin irritation, digestive problem, temperature sensitivity, fatigue. So what we can do for this? For the pain, not everyone who is dying experiences pain. Struggling with severe pain can be draining and make the dying person understandably angry or short tempered. This can make it even harder for the families and other loved ones to communicate with the person in a meaningful way. Administer pain medications as prescribed by the doctor. Agitation. About 75% of patients develop delirium agitation during the last few days of life. So treat causes if possible. Reassurance to the family. Typically controlled using clonazepam or midazolam, antipsychotics such as haloperidol or levomiprazole. Breathing problems. Shortness of breath or the feeling that breathing is difficult is a common experience at the end of life. Dying person has an abnormal breathing pattern known as chain stocks breathing. So to help in breathing, raising the head of the bed, opening a window, using a humidifier or using a fan to circulate air in the room, morphine or other pain medications can help to relieve the sense of breathlessness. Respiratory tract secretions. Saliva and other fluids can accumulate in the oropharynx and upper airways when patients becomes too weak to clear their throats, leading to a characteristic gurgling or rattle-like sound, death rattle. While apparently not painful for the patients, the association of these symptoms with impending death can create fear and uncertainty for those at the bedside. The secretions may be controlled using drugs such as hyoscine butylbromide, glycopyrronium, or atropine. Skin irritations. Keep the person's skin clean and moisturized. Gently apply alcohol-free lotion to relieve itching and dryness. Apply balm or petroleum jelly to the lips. Gently dab an eye cream or gel around the eyes. Try placing a damp cloth over the person's closed eyes. If the inside of the mouth seems dry, giving ice chips or wiping the inside of the person's mouth with a damp cloth, cotton wool, or specially treated swab might help. Sitting or lying in pressure ulcers position can put constant pressure on the sensitive skin, which can lead to pressure ulcers. Watch carefully for these discolored spots, especially on the heels, hips, lower back of the head. Turning the position of the person in bed every few hours may help prevent bed sores and stiffness. Putting a foam pad under the person's heels or elbows to raise it off the bed and reduce pressure. So digestive problems, nausea, vomiting, constipation, loss of appetite, swallowing problems. If the person loses their appetite, try gently offering favorite food in small amounts. Serve frequent and smaller meals rather than three larger ones. So, but don't force a dying person to eat. Losing one's appetite is a common and normal part of dying. Gastrointestinal system. Slowing up GI tract possible cessation, accumulation of gas, distension and nausea, incontinence due to loss of sphincter control. Bowel movements may occur before imminent death or at the time of death. So temperature sensitivity. When a person is closer to death, their hands, arms, feet or legs may be cool to the touch. Some parts of the body may become darker and bluish. People who are dying may not be able to tell you that they are too hot or too cold, so watch for clues. Someone who is too warm might repeatedly try to remove a blanket. You can remove the blanket and place a cool cloth on the person's head. Managing mental and emotional needs. Provide a physical contact. Try holding hands or a gentle massage. Set a comforting mood. Some people prefer quiet moments with less people. Use soft lighting in the room. Play music at a low volume. This can help with the relaxation and lessen pain. Involve the dying person. If the person can still communicate, ask them what they need. Be present. Visit with the person. Talk or read to them, even if they can't talk back. If they can talk, listen attentively to what they have to say without worrying about what you will say next. Your presence can be the greatest gift you can give to a dying person. Someone who is alert near the end of life might understandably feel depressed or anxious. It is important to treat emotional pain and suffering. The dying person may also have some specific fears and concerns. He or she may fear the unknown or worry about those left behind. And some people may experience mental confusions and have strange or unusual behavior, make it harder to connect with their loved ones. This can add to a dying person's sense of isolation. Spiritual needs at the end of life. Spiritual needs may include finding meaning in one's life, ending disagreements with others, or making peace with life circumstances. The dying persons might find comfort in resolving unsettled issues with friends and family. Visits from a social worker or a counselor may help. Many people find solace in their faith. Others may struggle with their faith or spiritual beliefs. Praying, reading religious texts, or listening to religious music may help. Thank you.